Good morning, good afternoon, good evening, depending on when and where you're watching this video from. This is Dr. Katie, your radio home. There is something for us to learn today. Of course, that's why I'm here. Today we'll be talking about causes of infertility in people who are assigned females at birth, people who have uterus. For the purpose of this discussion, I'll be referring to them as females. Causes of infertility in females, or female causes of infertility. Before we go further, I want us to define infertility. Infertility is the inability of a woman to get pregnant or a man to be able to impregnate his wife after 1 year of regular unprotected sexual intercourse. Some people have defined it based on the age of the female. They said if a female is higher than, if she's more than 35 years, it is defined as inability to get pregnant after 6 months of regular unprotected sexual intercourse. When she's less than 35 years, it's defined as after 1 year of regular unprotected sexual intercourse. Infertility can be primary or secondary. When it is primary, meaning that there is a history that the woman has never been pregnant despite sexual intercourse, that is primary infertility. Why, if it is secondary infertility, when there is a history that the woman was once pregnant, irrespective of the outcome of that pregnancy, and after that pregnancy she now finds it difficult to become pregnant, then you now say it's secondary infertility. Causes of infertility in females. 1. Uterine fibroid, hormonal imbalance, infection, pelvic inflammatory diseases, ovarian polycystic ovarian syndrome, endometriosis, hormonal imbalance. I talked about uterine fibroid. And idiopathic. There are some people who are unable to get pregnant, and you can't find out why they are not able to get pregnant. And some people with anatomical defects of the uterus, all right, congenital abnormalities. We'll be talking about all of them. For the purpose of this discussion today, we'll be addressing fallopian tube problems as a cause of female infertility. Fallopian tubes is a tube found only in females, and you have 2 of them, one on the left, one on the right, just like they have 2 ovaries. The ovary is where a woman produces the egg from, the egg that is being fertilized by the sperm to form babies. So we have 2 eggs, 2 fallopian tubes. The fallopian tubes connects this ovary to the uterus on both sides, such that when the egg is released from the ovaries, it will pass through the fallopian tube to be fertilized by the semen and then be implanted in the uterus, which is also referred to as the womb. So for women who have problems of the fallopian tube, they might find it difficult to get pregnant, and these problems will manifest in different ways. 1, it could be totally blocked. Okay, when it's totally blocked, the egg that is produced by the woman will not get to a place where the sperm produced by the man will get to fertilize it to form a baby that will now be implanted in the womb. That's 1. But remember, I told you there are 2. 1 can be blocked, and when 1 is blocked, the other one should be able to do what can help the woman get pregnant and have babies. But most times the problem is such that what has caused the blockade in the other side, what led to the blocking of one part, has also affected this other side, irrespective of the fact that it's still opened. Okay, what it means is that despite the fact that it's opened, it must have also suffered the same consequences that led to the blockage of the other one, and so might not be able to function optimally to support fertility in such women. But there are some women too who have been able to bear children with 1 fallopian tube. So when the 2 are blocked, it means that the woman will not be able to get pregnant at all. There is no chance, because there will be no way for the egg she's producing to be fertilized by the sperm that is coming from the husband. 2, it is possible that it is not blocked, all right, but there are problems with the tubes. What kind of problems can be there? The fallopian tube has got what they call cilia. It's like hair. There are tiny things that is inside the tube. Okay, what they do is that when the egg is produced and fertilized, they will be moving in the direction of the uterus, trying to push that egg and the fertilized semen, when it's not fertilized egg, fertilized by the semen, to the womb where it will be implanted and grow. But people who have had gonorrhea, chlamydia, sexually transmitted infection, and the pelvic inflammatory diseases and all that, this cilia must have been damaged. This damage is worse with gonorrhea infection. So when it is damaged, the sperm might succeed in fertilizing the egg because it's still patent. But because of the abnormality of that tube, the fertilized egg will not be able, which is an embryo, will not be able to go to the womb of the woman to go and implant there and grow. So for such people, they will be predisposed to ectopic pregnancy. I have a video streaming on ectopic pregnancy, how to prevent death and sudden collapse from it. Watch out, make sure you look for that video and watch it. It's very impactful. So for such people, they will have ectopic pregnancy, and if they don't diagnose it early, it can rupture and they will bleed. Some people can die. Some will have a significant comorbidity. You know, they will be in the hospital for a long time. They have to transfuse plenty amount of blood to be able to come back to life and all that. So another thing that can happen, that tube is a soft tube, tiny, and it has a way that it moves, you know, in such a way that whatever egg that is fertilized there, it can help it go to where, in the womb of a woman, to the womb of a woman where it will be implanted. But when there is infection, the tubes that have suffered from infections, recurrent sexually transmitted diseases, pelvic inflammatory disease, that tube will become rigid, fibrosis. It can become strong that it will not even try to move to help the egg get to where it's going to. That will also predispose to ectopic pregnancy. And then, if it is blocked, what are the options? It is true that there are surgical procedures they will use to open up the tube, but the success is actually a poor one. Why? When they open it, it will open. But when you are still waiting for pregnancy, that tube opened can block again. Okay, it's like a muzzle. It's not an iron or a ring that will maintain. If it's like this, it's like this. It's a soft tissue. Okay, so when a muzzle, infection has eaten up the lining that will prevent it from gumming. Okay, so when you now open it up, surgery, there is no endometrium, there's no internal lumen, there's no, I don't want to give you things that you will not understand. That shiny thing that God has put inside to keep it so that it will not gum together, infection has destroyed it. So even when you do surgery to open it, in a short time, it will block again. So you will return to status quo. What that means is that you go back to where you were before, blocked tubes. So the options that you have for completely blocked tubes or fallopian tubes problem. Some people have had ectopic pregnancies, and that ectopic pregnancy has led to them losing their tubes, because when the baby grows there and it ruptures, at the time they do a surgery to save the mother, they will cut off that tube. And some people have got to have ectopic pregnancy on both tubes and it's been cut. Such people who have had both tubes cut, you are in the same class with people who have bilateral tuber blockade. So whatever option they have is what you have. So listen attentively. If ectopic pregnancy has led to the removal of your two tubes, you are going to sought care like somebody who has gotten bilateral tuber blockade, that's fallopian tube blockade. So the option for you is to go for IVF. Okay, they will fertilize the egg outside and help you put it into the womb where it will not implant and grow. There are a lot of controversies there, but I want you to know it's God that gives power and knowledge for whatever is being done. So we will not address these controversies today, but I'm telling you that IVF will help you get pregnant and achieve the desired goal as a woman, as a man, to have your own children. And it's even early. I advise you to get to do it early, because when you do it early, your egg as a woman and the sperm of a man will be used, and anytime is your baby. It's just that you didn't wait to have them by connecting your fallopian tube to have the sperm and the egg to meet. It's still your sperm and your egg, your sperm and your wife's egg that met anyway. So it is better to do it early, because if you waste time, keep refusing or rejecting, and you are now old, your egg will not be used, because your baby will be at risk of congenital abnormalities that are increasing with increasing maternal age. Okay, so they want to be looking for another egg and all the other complications that will follow. That will be a topic for another time. So you need to sort medical egg early and do the IVF, because the tubes will remain blocked. You know, this is where faith will come. People begin to say you don't have faith, that if you have faith, your tubes will open. I agree with you, God can do everything. But if God is not doing it at that time, God can do it in another way, because there are people who have done IVF that are not successful. So successful IVF is the hand of God too. All right, so you need to sort help early and be helped. Another way, like I told you, it could be that the cilia has been damaged. The cilia is damaged, the tube is not, has lost its integrity, and therefore not able to carry the embryo to the uterus to implant. It is still the same help, okay? Meaning that your fallopian tube has failed. IVF will help you. Sort it as early as possible. So some people who want to know the causes of fallopian tube blockade. Repeated sexually transmitted diseases is the number one culprit for fallopian tube problems. All right, number one culprit. When the infection keep coming, especially when you do not diagnose them early, or when you poorly manage them or poorly treat such infections. Some people will not know. It will be ongoing until they now start having vaginal discharge, vaginal itching, and all the other lower abdominal pain. And at that time, the infection has been there for a long time. Okay, unprotected sexual intercourse will predispose such an individual. Multiple sexual partner will predispose such an individual to sexually transmitted diseases. So another cause, people who have got endometriosis, we are going to talk about that. It's a special topic too, as a cause of infertility in female. It can also predispose them to fallopian tube blockade. So whoever has got a fallopian tube blockade, it's not the end of the road. But what I'm telling you is that you need information. Go to the fertility clinic and register for in a place where they got a IVF facility, and help yourself. Don't kill yourself with depression, waiting for so long and trusting. There is help, medical help for you, and ensure that you sort that help as soon as possible. My next video will be discussing uterine fibroid and all the topics, all the causes of female infertility we have talked about today. We are going to be discussing them each in subsequent video. Make sure you are there to learn, okay? Don't be sad, you will have your baby, provided you are willing to do something. Thank you. Hope you have learned something today. Ensure that you tell people that are in this same problem so that they can learn. Share the video so that people can learn and find help for their medical condition, so that they can have their desired dream of being a mother or being a father. Bye.